Hi, everybody. It's Rob here at Washington State Funeral Directors Association headquarters. I wanted to share with you a letter that I had received from the Indiana Funeral Directors Association. It was written by their board of directors and sent to their membership. Some of their membership was kind enough to share it with me, and I wanted to share it with you. We will be putting this letter onto our Facebook page, so you'll be able to read it. We'll be adding it to all of our emails and things like that, so you'll be able to have a copy of it. Just know that this letter, I have changed some of the information to be reflective of Washington State as opposed to Indiana, but they did such a great job in writing this letter to their membership that there was no sense in reinventing the wheel. This kind of hit every single key point that we need to share with everybody. So I'd like to read you this letter. Again, it's from the Indiana Funeral Directors Association, and we've made some slight changes to make this reflective for Washington State. So bear with me, it is a little bit lengthy. In the last few weeks, we have been in, the last few weeks have been an unprecedented time in our country. It's been filled with anxiety and uncertainty, along with a never-ending flow of information, much of which is well attended and somewhat confusing. As the coronavirus pandemic, or COVID-19, evolves in the United States, information has been moving faster than it can be disseminated. As an association, we are mindful and judicious in balancing between providing information in a timely, useful manner versus impulse overreaction every time information is put forth, thereby adding to the confusion. Today, however, we offer this advisory update for your careful consideration. Recently, the Center for Disease Control, or CDC, significantly lessened their recommendation for gathering sizes from 250 people to less than 50. As of March 16, the CDC's update states during the next 15 days, all US events of 10 plus people should be canceled or held virtually. The CDC is strongly encouraging you to implement application of this limit. Below are some links that you will find helpful as you prepare and work during the next several weeks. You'll find when you read this letter, there's a link to the White House website. There's a link to the CDC website. There's a link to a new website called coronavirus.wa.gov, the Department of Health website, and the NFDA's coronavirus website. We'll continue the letter. While this situation locally and nationally currently remains in a dangerous yet manageable position, time and application of recommended preventative protocols is actually critical, as this could change rapidly and potentially overwhelm our healthcare system, especially if preventative protocols are not followed and adhered to. It is the fundamental responsibility of every citizen to do their part to help suppress the spread of this virus. It has been reiterated on multiple occasions in the weeks leading up to today that we should expect many to be infected by the COVID-19 virus in the United States. Likewise, it has been communicated that during the virus escalation time period, which could be several weeks, we could expect a number of active cases to double every 3 to 4 days. Our best defense is an offensive mindset of personal responsibility, highly focused on personal hygiene, and with exposure limitation being the highest priority. We are seeing worship services being temporarily suspended, schools and universities nationwide eliminating in-person classroom instruction for the remainder of semesters, moving to an e-learning platform, a sizable portion of the workforce largely telecommuting for the foreseeable future. Tradition-rich national and local events are being canceled every day. We are all having to make temporary adjustments and sacrifices for the collective good of our country. This cautious, preventative mindset could prove to be the difference between a truncated, in duration pandemic event with minimized negative outcomes or a national catastrophe with lasting effects far into the future if we fail to prudently yield. We are fortunate to have the opportunity and choice in how the outcome plays out. The questions from your perspective now that we're hearing are, how do we handle public funeral events in light of this ever-evolving COVID situation? How do we potentially limit attendance? How do we discuss scenarios with families in our care? What are the best practices and limits of what we should do? Professionally, you have a multi-point duty of care. This duty of care is equally and lawfully to public health and welfare, reverent, dignified care of the deceased, and compassion to those who grieve. This is a responsibility that each of you are well versed in and experts of. Under normal circumstances, this requires much of you. Times such as these challenge your stewardship beyond your known limits. As your association, below is some suggested best practices, which we feel require consistent attention and engagement. The Washington State Funeral Directors Association encourages you to implement the following. Number one, be a voice of reason and calm in your communities amidst the chaos and uncertainty. Be the common sense beacon that your community expects and knows you to be. Number two, establish lines of communication with your local county-led emergency management officials. Each county should have in place an emergency management plan, which probably has been implemented by now. These resources will become invaluable if the situation begins rapidly changing and they are tied into a large statewide plan. In times such as these, communication and implementation are keys to success. Number three, we strongly advocate and encourage you to follow the guidelines closely, as they are always ever changing, set forth by the President of the United States, the Governor of the State of Washington, the Washington State Department of Health, and the CDC. They are all requiring handling of COVID virus, including encouraging coworkers and employees who feel sick to stay home. With additional heightened focus on hygiene and cleanliness, we give special attention to limiting sizes of public assemblies. And again, there's some links that you can look at to see what those limits would be. Here's just a brief excerpt, though, of the latest information that we have from Governor Inslee's office. On March 16, Washington State Governor Jay Inslee announced the statewide closure of entertainment, leisure, and non-essential services and an emergency proclamation labeled 20-13 coronavirus. This is now in effect and will be in effect through March 31st. In that proclamation, it states additionally all gatherings with under 50 participants are prohibited unless criteria from the CDC for public health and social distancing are met. Furthermore, on March 16th, the CDC also revised their recommendation to include canceling all events for groups of 10 or more people. Public funeral events naturally have heightened potential to be hotspots for transmission and the spreading of COVID-19. It is reasonable to expect future restrictions to be mandated for funeral-related events. With the transient nature of attendees, if exposure were to occur, it could potentially be accelerated due to the multitude of directions and destinations the attendees would travel to or frequent after the funeral event occurred. Recommendation number 4, be ever mindful that your statutory duty of care in its most fundamental form is public health and welfare. All that you say and do relates back to this responsibility. In working with those who have died, experienced loss, the public, and those who are co-workers and employees of the funeral home, advocate in writing and action adherence to prevailing recommendations and mandates most especially hygiene and restrictive assemblies and gatherings. Recommendation 5, review guidelines and be staunch advocates of OSHA universal precautions within all the environments that you interact. Recommendation 6, ensure that your personal protective equipment or PPEs is in proper use and replenished. We are aware of the possibility of shortages, so be diligent and creative in seeking solutions, which may include the use of your current funeral suppliers, non-traditional suppliers as well, online purchasing, and collaborating with neighboring funeral homes providers to pool resources. Recommendation 7, make a focused cleaning and disinfection of person and spaces a top priority and a constant, ongoing process throughout the day. Cleaning soaps, hand sanitizers available and monitored for replenishing. Handshakes and hugs should be discouraged. Personal distance awareness encouraged. Protecting those who are most compromised with underlying health conditions, including requiring employees and coworkers to remain home if they are in high-risk categories, and or encouraging reduced workforce or work from home whenever possible. Recommendation 8, in your funeral homes, through posted signage, through your on-hold messaging on your website and in social media platforms, be proactive with advocating for prudence and careful consideration as services are planned and events considered, using the suggested and mandated protocols as a resource to proper decision making. Please use the links provided to embed into your own communication plans. And again, those links are listed on this letter. Recommendation 9, think in terms of how your duty of care is applied in best practices and exposure. There's significant exposure points that require constant best practices management. Some of those exposure points include at the first call, interactions at institutions and homes, potential hotspots for virus. Remember, you have no known data about the person or place prior to engagement with them. Personal protection at all times is required through the use of PPE. Your initial contact with the decedent, the environment the decedent is received from, and where your care begins. The state of Washington's largest known concentration of the virus, causing multiple deaths, was a nursing home. Your vehicles in which you transport decedents can become incubation sources if not cleaned after every use. Make sure that the vehicles are well stocked with cleaning supplies to assist and maintain a virus-free environment. Preparation of the decedent and containment of preparation of environment. You want to do this through disinfection of all cavities and orifices with special attention to the nasal, oral, and general aspiration of the body. There's little known about the duration of the virus living in a deceased individual, therefore err on the side of caution. Personal decontamination is paramount at all times when exiting a preparation room environment. Be extra conscious of this when caring for a body potentially infected with COVID-19. Containing infectious waste from your preparation area, including that which accompanied the deceased from their place of death and that which was created in the preparation of the decedent. In the arrangement conferences and the interaction with family members, with little knowledge of where people are arriving from and what they've been exposed to, limit the number of people in an in-person arrangement conference, or even start conducting conferences over your telephone, video conferencing, or with at least significant space between the person during the conference itself, and all prudent policy positions. For public gatherings or funerals, this has been a question that has come up pretty regularly. Here's some thoughts on best practices. Think in terms of using technology to potentially help minimize large gatherings. Tools such as Zoom, Skype, Facebook Live, potentially private events now with public events later. Type planning should be prioritized over current public events. In the event, in an event with limited attendance, such as a private event or gravesite is planned, discourage physical interaction among those in attendance with the deceased COVID-19 person, including touching, kissing, dressing of the decedent. If religious customs require involvement with the deceased, be extra cautious in the disinfection of the body prior to the interaction. Likewise, advocate for limiting interaction with special awareness among those in attendance, along with preemptive, precautionary, disinfecting practices by the staff and funeral home, including constant surface cleaning in and around public areas, bathrooms, register stands, doors, open the door for people, the possible transportation vehicles such as limousine, even how close you get or set your chairs is of high importance. This is a virus transported through vapor droplets such as coughing, sneezing, crying, all of which are very much a part of funeral events. Your facility may require heightened attention to door handles, all touch surfaces, furniture, bathrooms, prep room, garages, offices, kitchens. Everything must be considered when implementing your exposure control plan if decided to have a limited public event. An attitude of prudence and caution, while being considerate to the circumstances around the death of those affected by it. It is the never-ending focus, but those circumstances require a modified approach. Yes, there will be difficult days and conversations ahead, but the attitude of open, honest dialogue will ensure reason will prevail and virus suppression will have an opportunity to take hold. As previously stated, we all share fundamental responsibility to act in a manner that is consistent with virus prevention and suppression. We must constantly ask ourselves, are my actions aiding in and consistent with the expected desired outcome, or are my actions a hindrance to a positive outcome, thereby assisting in the deterioration of this situation? Please stop and think about this for a moment. Knowing what we know and the recommendations that are being presented to us about minimizing large groups or canceling of large groups, if you and the family you are caring for decide to have a public funeral event, and this event is found to have been a source point for expanding this virus, it is reasonably arguable that you and the family are acting in a manner of gross negligence and subject to recourse for such. These are serious times and require serious actions by all. During perilous periods in our nation's history, our communities, our citizens, the greater welfare of our country endured because of the rational, steadfast, undying fortitude of our American spirit. We are yet again at another pinnacle point in our country's journey. While we are passionate for our own personal causes, we must yield to common sense and the greater public welfare in the application of our duties. While we did not cause this current situation to occur, we are all forced to face it today. The bright light is we have a choice and opportunity in the solution. As the Washington State Funeral Directors Association, we stand vigilant and committed to help you in any way we can to stay informed and prepared as this situation evolves in the coming weeks. This was a letter, as I said, that was sent out to the Indiana Funeral Directors Association. We borrowed the letter because we couldn't have said it any better than what they shared with their members. If you want a copy of it, it will be on our Facebook page. It will be on our website. I will email it out to you. If you don't receive it, please contact me and we will get a copy to you. If you have any further questions, if you want to talk any further, please contact us at any time, and we would be happy to share any information that we have, and we would be happy to receive any information that you have to share with the general public. Keep washing your hands, stay safe, and stay well protected. Thank you.